Hi there, John here from Backwards Compatible, or should I say Dr. Nigel. I'm playing Surgeon Simulator Touch on the iPad, and I've already shown a few videos that have been made directly from inside the app. It's got a great sort of recording and voiceover function within the app, but I'm doing this a bit more professionally now, and I'm performing eye surgery. So as you can see here, I'm using all the tools provided, and they're very hard to use. And as I said before, Bossa have done a really good job of recreating the frustration of manipulation of objects within the game. I would say they are marginally easier to use than the PC version, because touch is a bit more natural. However, it's a lot harder to judge distance and space. I'm at the moment taking the goggles off the patient. Most of the operations have a level of challenge where you've got to do ridiculous things like remove things with knives and scissors that you could do with your hands. I've got to try and perform eye surgery on this chap. I've read a few instructions from the ICAS, which is the PDA that comes in the game. And step one is to gouge the eyes with a scalpel. You'll notice I'm using the green syringe there. And that seems to reduce blood flow. Every time I inject him, you'll see in the top right corner the blood flow is dropping, despite that gushing coming out. And you can see his eyes kind of popped out. But you know, God, I have no idea what's going on here. You get very little hints and tips. It's a lot of it sort of trial and error. I have played this many times, this level. I would say at least 30 to 40 goes at this. You can see in the top right corner also your blood level, and that kind of acts as your health, really. If that drops to zero, your patient bulb is dead. You can also see in the background his heart monitor. So there's a button in the top right corner which is the anaesthesia, which drops down with the heart rate as well. It's getting very high at the moment, you can see. So I need to do all that fairly quickly. There we go. And that brings the heart rate down. And removes those red fringing around the screen as well. So, you know, I'm just sort of hacking away here, and I'm told that whacking the eye once it's popped out with the hammer will help as well, but I've no idea why. To manipulate there you go, there's the eyeballs come out now. To manipulate the instruments, you have to hold it with one finger and then tap where you want to strike with the other finger, and that kind of aligns it up. And it is a dynamic you get used to eventually. So here I am whacking the side of his temples with a hammer. Bang. I can't see why this is any use, but the hints and tips are smack his temple with a hammer, which should make cutting the tendons behind the eye easier. So a lot of this is sort of micromanagement, really, you know, keeping the blood levels higher, keeping the pulse rate low, keeping the blood flow rate low. And if you do get to the point where your patient's heart rate is dropping really low, you can see just up there in the middle left of the screen is a resuscitator as well, which I have used as an achievement for using that, bringing it back from the dead. But yeah, the achievement system works quite well with this. I mean, it's linked to Game Center. And so every so often you get these achievements, and they pop up just like they do on the consoles. It's quite a nice use of them, really. Here I'm trying to cut the tendons behind the eye. Bit of touch and go, really, hacking away. There's no real indication of where you have to strike, but I'm guessing below the eyeball. I'm trying to be as gentle as possible. You can see the blood's coming out. Some people can do these surgeries in about 20 seconds, and I'm amazed. I'll have to watch some of those videos, maybe link to them on this page as well. But you know, it's the third operation, and the difficulty is ramped quite high already. The difference in how long it took to do the last operation compared to this one is quite astronomical, really. Oh, there goes his eyeball. So you can see the jar here on the left. I'm going to choose another eyeball, pop it in. I've chosen a rather unusual eyeball there. Now here's where I stopped and thought, I've done that now, I've done the eye transplant. Now what? Nothing happens, the game doesn't finish. And it does dawn on me here, with only about 1800 millilitres of blood left, I've got to do both eyes, haven't I? I've got to do blinking both eyes. I'm looking around trying to figure out if there's anything to press or squeeze. Here's some buttons to press. It's almost like the Stanley Parable at this stage. I'm just desperately trying to find something that finishes the game. But I think back in my mind I know it. I've got to do both eyes. I've been fairly laissez-faire with that eye, so I'm going to have to be pretty fine with this eye to get this done with those 18 mils left. So there's no beating around the bush here. I'm going to have to do the other eyeball. Alright, so I'll grab one of my remaining scalpels and make a start on the other eye. We've only, again, 1700 mils left, so I'm being very careful with my gouging here. Making sure my blood loss is pretty minimal. It's quite tense here, and you kind of get the feel in a really minimal way of what surgery might be like when you're under pressure to get certain things done when conditions are conspiring against you. I say that in a loosely sense because this is nothing like surgery. But yeah, this was tense this last few minutes, and here I am sort of multitasking all the different bits and bobs. I'm hoping just a good bit of gouging and then fixing it with the hypodermic here might help. Quick. Here we go. Jab it again. It almost got to sort of desperation here, really. I've done this so many times. Another jab to help him out. I've got 700 mils of blood left. And I'm going in. Come on, out you come. Oh, goodness me. Then I got lucky. One more gouge. There's got to be one more gouge, surely. Chuck that in there. Splatch. Go on, chuck it in. There we go. One more injection, just to make sure. Watch what happens here. Out comes the eyeball. Look at that. 150 mils of blood left. I've still got to cut all those tendons. Got to be really careful here. Heart rate's okay. Here we go. Carefully does it. Oh, okay, it's close. A couple of tendons left. 80 mils of blood left. Keep the blood flow, the blood loss down. One more incision hopefully should do it. One more incision. Let's give it a go. Gouge. Oh, it's tense. Gouge. Come on. Check the blood flow, that's fine. 80 mils of blood left. No, sorry, 60 mils of blood left. Let's pop that last eye in. Oh no, I've dropped the eye. Let's try another one. There we go. Pop it in and... Oh, thank God. And I got an extra achievement for having the wrong colour eyes as well in each eye socket. Finally. Well, thanks for watching, and check out our channel for more videos like this. Hopefully I haven't made you too sick. Cheers.